Okay, this is a continuation of the endocrine system, Cushing syndrome, Cushing syndrome. Adrenal cortex secretes excess of glucocorticoids on the pituitary gland and excess of ACTH as a result of either a pituitary tumor, adrenal tumor, or from glucocorticoid therapy. Signs and symptoms. Patients have a moon face during excess cortisol production, buffalo hump, fat pad located on the upper back, osteoporosis from excess corticosteroids, absence of menstruation from effects of excess steroids. Okay, diagnostic test, dexamethasone suppression test, increased cortisol in 24-hour urine, CT scan, you'll see the tumor, elevated blood glucose due to the production of steroids, the increased production of the steroids, increased sodium due to excess fluid loss, and you're going to have decreased potassium. Okay, the treatment, surgical removal of the pituitary tumor or the adrenal tumor. Nursing interventions, you're going to get a daily weight to monitor the fluid status, monitor INOs, monitor for glucose and acetone in the urine. Avoid trauma to the skin due to corticosteroids, delay wound healing, bone density to assess for osteoporosis, and that's due to the corticosteroids can leach calcium from the bones. After surgery, assist in early ambulation, deep breathing, coughing to facilitate mucus mobilization, and decrease emboli risk. Monitor the incision site for drainage, redness, and signs and symptoms of infection. You want to explain to the patient the need for a high-calorie diet, high calcium to aid in wound healing, and high calcium, give pain meds as needed. Okay, next, primary aldosteronism or Cont syndrome. Pathoadrenal cortex is secreting increased amounts of aldosterone caused by an adrenal tumor. Adrenal cortex malfunction. Some meds such as calcium channel blockers can decrease the aldosterone levels, and this can confuse the diagnosis. Signs and symptoms. Elevated blood pressure caused by increased aldosterone. Headache due to the increased blood pressure. Muscle weakness from decreased potassium level. Increased urination. Diagnostic test, decreased serum potassium, increased urinary aldosterone. 24-hour urine collection. Monitor the aldosterone, creatinine, and cortisol levels. And next we have the treatment. We're going to give the patient diuretics to control the hypertension and elevated potassium levels. You can give them aldactone. Give meds to block effect of aldosterone. They can surgically remove the adrenal tumor. Nursing intervention, restrict the sodium intake. You're going to do a daily weight. Monitor INO, explain thirst. Dry mucous membranes are caused by the low sodium. Allow sips of water and ice chips. Pheochromocytoma, patho, A tumor on the adrenal medulla secretes excessive epinephrine and norepinephrine. Signs and symptoms: headache as a result of hypertension, palpitations and tachycardia due to increased catecholamine production, dilated pupils from increased production of epinephrine and norepinephrine, diagnostic tests, catecholamines in serum, increased catecholamines, metanephrines, and VMA acid in 24-hour urine. A CT scan will show the adrenal tumor. Treatment: surgical removal of adrenal tumor. Give antihypertensive medication to help lower the blood pressure. Give beta blockers to decrease the effects of epinephrine and norepinephrine. Procardia, propranolol, nifedipine. Nursing interventions: monitor the blood pressure. Give blood pressure medications. Monitor urine for catecholamines. Reduce stress. Explain they need to quit smoking. Reduce caffeine and decrease the blood pressure. Okay.